Hello, and welcome back. So the questions are my menstrual blood clots normal? And the other question, how do I know that my menstrual blood clots are abnormal? I'm your favorite medical microbiologist, Gwendolyn Halley. Stay tuned for more. Hello and welcome back to my channel. Before we go into the topic of today, I would like to take you through a brief explanation on how menstruation works or on how menstruation happens. Every month or during a woman's menstrual cycle, there is a period where the womb or the woman's body or the uterus is preparing for pregnancy. That is, the uterus or the womb actually begins to produce new tissue and coat the uterus or the womb while preparing for pregnancy. Now, when pregnancy doesn't occur, what happens? This new tissue begins to shred little by little. It combines with mucus, with blood byproducts, with tissues, and it flows out like menstruation, like menses. Now, have you ever asked yourself, why is it that whenever I bruise my skin or whenever I have a cut on my skin, I don't bleed to death? That's because the platelets that are responsible for coagulating blood actually coagulates the blood and actually prevents you from bleeding to death. Now, this is not the same in the womb or uterus. In the womb or the uterus, there's an anticoagulant that is being produced and prevents the blood from clotting. Because if this blood clots, it will block the cervix and prevent the outflow of blood, and it may cause infections. So this anticoagulant helps blood to flow out easily, and it empties your uterus or womb while preparing for the next menses day or the next menstruation. Now, what happens when you have heavy periods? When you have heavy periods, this anticoagulant ends and then coagulation starts. So yes, it is normal to have blood clots during your menses, but in tiny diameters, not in big lumps and not frequent. If you are a lady who takes a lot of milk or dairy products before your menses or during menstruation, you will notice a lot of clotting. That's because there is an enzyme in the milk that actually promotes coagulation. How would you know your menstrual blood clots are abnormal? Firstly, when they come with a lot of pain, intense pain. Secondly, when your menstrual flow is very heavy. Thirdly, when the blood clots are bigger, are larger than a quarter. And next point and last is when the blood clots are frequent. That means from the beginning of your menses, till the last day of your menses. Then you should be worried. So what are some of the causes of abnormal menstrual blood clot? Point number one, some medications. Some medications that we take can actually provoke this situation. The next point is contraceptive pills or some forms of contraceptive injections, implants can actually alter our menstrual blood flow and cause more clots. The next point is ectopic pregnancy. If you are pregnant, because there are some women who are actually pregnant and have their periods, they actually have their menses, they actually menstruate during pregnancy. So if you are pregnant, you should be looking out for an ectopic pregnancy. You may have an ectopic pregnancy. That is why you're having these abnormal menstrual blood clots. The next point is miscarriage. If you're pregnant, you should be looking out for this. because you could actually be having a miscarriage when you experience this abnormal menstrual blood clot. The next point on our list is fibroid, which is very common in a lot of women. Fibroid is a non-cancerous growth that grow in the uterus or in the womb, and most times they cause pain, infertility, and a lot more. So you should be looking out for that. Many women who have fibroids experience this abnormal blood clot during their menses. Our next point is endometriosis. Endometriosis is when the endometrium, that is the tissue that lines the uterus of the womb, that normally shreds out during menstruation, actually goes out of the womb and begins to grow on the fallopian tube, on the ovaries and other areas. And this causes severe pain around the pelvic area and infertility in some women. The next point is endometriosis. Endometriosis is when the endometrium, that this tissue that is supposed to be normally lining the inside of the uterus or the womb, then goes out and begins to grow in the uterine wall, in the walls of the uterus or the womb. This is not good, and this is very bad. And next point is polycystic ovarian syndrome. This affects the ovaries of a woman, and you have cysts that begins to grow on the ovaries, making them enlarged and very painful. So this is not very good. We also have thyroid diseases. And in this case, we're talking particularly of hypothyroidism, which you should look into. I'll take them all over again. We have miscarriages, we have ectopic pregnancy, we have some contraceptive pills or implants or injections, we have some medications, we have thyroid disease. In this case, we're talking about hypothyroidism, we have fibroid, we have endometriosis, adenomyosis, and polycystic ovarian syndrome. So as a lady, take note of this. Now, also note that if you are female and during or before your menses or your menstruation, you take a lot of milk or dairy products, just know that you will experience a lot more clotting, because there is an enzyme in milk that actually promotes blood clots. Hope you have been enlightened by this short teaching. I want to thank all my returning subscribers. I am very grateful. I'm very humbled. And if you just joined this page or stumped on this video, I would love to say you're welcome. Don't forget to like, share, comment, subscribe, and be part of this family. Till next time, I'm your favorite medical microbiologist, Gwendolyn Halley. Bye-bye.